In this video, I will cover the current situation of Cyclone Tauktae. Monster cyclone heads for COVID hit India. A large cyclone with fierce winds and the threat of a destructive storm surge moved towards India on Monday, disrupting the country's efforts to combat the devastating COVID-19 outbreak. At least 6 people died over the weekend in torrential rains and winds as Cyclone Tauktae, in line with press reports, the most significant to hit western India in 30 years, swept across Arabian Sea with Gujarat state in its sights. The extremely severe cyclonic storm was expected to make landfall between 8 p.m. and 11 p.m. Monday with winds of 155 to 165 km per hour, gusting to 185 km/h, according to Indian Meteorological Department. Warnings of storm surges up to 3 meters high were issued in a number of Gujarat's coastal districts. The colossal swirling system, visible from space, exacerbated India's dire problems in coping with a huge coronavirus wave that is killing at least 4,000 people a day and pushing hospitals to the brink of collapse. In flooded and windswept Mumbai, where authorities closed the airport for several hours Monday and told people to stay indoors, authorities on Sunday moved 580 COVID patients from 3 field hospitals to safer locations. In Gujarat, where quite 100,000 people were evacuated from 17 districts on Sunday and overnight, all COVID-19 patients were also shifted to hospitals within 5 kilometers of the coast. Authorities there were trying to ensure that there would be no power cuts in the nearly 400 designated COVID hospitals and 41 oxygen plants in 12 coastal districts, where the cyclone was expected to hit hardest. To ensure the COVID hospitals do not face power cuts, 1,383 emergency generators have been installed, a senior official said. Pankaj Kumar. 35 green corridors have also been set up to supply oxygen to COVID hospitals, he said. Virus safety protocols like wearing of masks, social distancing and therefore use of disinfectants would be followed inside the shelters for evacuees, officials added. The state also suspended vaccinations for 2 days. Mumbai did an equivalent for some time. Thousands of personnel deployed. Thousands of disaster management personnel have been deployed, and units of the Coast Guard, Navy, Army and Air Force have been put on standby, they said. Maharashtra evacuated around 12,500 people from coastal areas. 4 people died on Saturday as rain and winds lashed the state of Karnataka, while 2 people died in Goa when winds affected power supply and uprooted trees. S.M. Bandekar, Dean of Goa Medical College Hospital, GMCH, said a COVID station suffered minor flooding as rain came in through open windows. But there was no way to shift patients, he said, adding that hospitals in the state did not suffer from the outages because they had backup generators. 2 others were reported dead and 23 fishermen were considered missing in Kerala, local media said. Terrible double blow. The vast nation of 1.3 billion people reported 4,100 deaths and 280,000 new COVID-19 cases in the past 24 hours on Monday, bringing the total number of people sickened to 25 million, a doubling since April 1. This cyclone may be a terrible 1-2 punch for many people in India whose families are being hit by record COVID infections and deaths, said Yudayuregni of the International Federation of Red Cross and Red Crescent Societies. The organization said it had helped authorities evacuate the most vulnerable people in coastal areas, provide care masks, and promote other critical COVID-19 prevention measures. Last May, 110 people had already died after Super Cyclone Amphan devastated eastern India and Bangladesh and the Bay of Bengal. The Arabian Sea previously experienced fewer severe cyclones than the Bay of Bengal, but rising water temperatures due to warming were changing that, Roxy Matthew Cole from the Indian Institute of Tropical Meteorology told AFP. The Arabian Sea is among the fastest warming basins in the world's oceans, he told AFP. Thanks for watching. If you liked the video, please hit the like button. If you want to see more videos, hit the subscribe button. And if you have something to say, please leave a comment.